I'm going to take the opportunity to educate you today. A sound may be an inlet that is deeper and a bit wider than a fjord.
Well, so I was going to try to relate it to a fjord.
Of course, yeah. I knew you were. You're a big Scandinavian.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
It's another cold winter Monday, and that means it's time for another episode of Ask an Audiologist. I'm Kevin Ziener.
And I'm Dr. Michael Squires.
Today's topic is one of scandal and manipulation, the likes of which are usually reserved for a Game of Thrones episode.
Yes.
We are talking about whether or not it is possible to cheat on a hearing exam. So you can't be Littlefinger. You need to be one of the good ones, which I can't remember anymore. You can't be a Lannister.
Yeah.
You can't be...
Be a Stark?
You could be a Stark. You want to be... Well, do you want to be Jon Snow? Because Jon Snow was altruistic.
Well, sure. I'll be Jon Snow.
You be Jon Snow.
Yep.
So this article is written by Dr. Madeline Henry of Link Audiology in Silverdale, Washington, which of those of you who love geography is across the Sound from Seattle, Washington.
You'd have to fly a dragon to get there.
I do have a question for you. So Dr. Squires is from West Virginia. Do you know what a sound is? Not sound the noise, the body of water. Can you properly identify what a sound is? Well,
I mean, I can identify when somebody points to a sound on a map, but we don't have any sounds in West Virginia.
So a sound,
we have rivers.
I'm going to educate you. I'm going to take the opportunity to educate you today. A sound may be an inlet that is deeper and a bit wider than a fjord.
Well, so I was going to try to relate it to a fjord.
Yeah. I knew you were. You're a big Scandinavian. Or a narrow sea channel or an ocean channel between two land masses, such as a strait.
There you go.
And now, thank you all for tuning in. That's going to be it for this episode of Ask an Audiologist.
That's the end of this episode and the podcast.
We talked about Game of Thrones and we talked about bodies of water. We're good.
Yeah.
We've done what we came for. Yep. All right. So now you're educated.
Yeah.
Now it's your job to educate other people on how and why anybody would want to cheat a hearing test.
Yeah. I think it really just boils down to intention.
Okay.
Right? So winter is coming. Right?
Oh, yeah.
So
if we can be real thick with the Game of Thrones lines,
I'm
with
as hard as I can.
Okay.
So in reality, not very many people have the intention of cheating on a hearing test.
Right.
However, when money is involved, it certainly is a possibility.
Okay.
So we as audiologists are trained, believe it or not, in our graduate programs to kind of spot the red flags.
Oh.
And so we test in several different ways. There's not just one, ain't no way, one way to skin a cat.
Sure.
We do our test, and if it looks a little peculiar, then we'll retest it in a different way.
Yes.
And what we're looking for is consistency. And oftentimes it's really hard. If you're a good audiologist, it's really hard to cheat.
Got it.
It can be done. You can do it. You're just not going to get by with it.
Well, is it because of the technology you use, or is it also part technology, part I clearly know I'm being jerked around here?
It's art and science. Well, here's the thing. Some of the testing that we do relies on the patient to respond.
Yeah.
But we have technology available to us to test objectively.
Okay.
And so it doesn't require any type of a response. And if these two things don't match up, we go, where are we
Something's
going?
off here.
Well, where are we going here? Yeah.
How often, so assuming just a patient is good, like they're coming in because they're coming in for all the right reasons. They just want a baseline and they want to understand where their hearing's at. That's probably usually a one and done, assuming there's not, cerumen removal or something goes wrong.
Sure.
When somebody is intentionally trying to skirt the line, how many tests will you administer before you're like, what are we doing anymore?
Yeah. So typically I'll knock it out in one appointment. And,
okay.
I'm not having to have like serial appointments.
Yeah.
Typically what I look for is the red flags right out of the gate.
Got it.
Like, oh, listen, it's really bad. Doc, it's really, really bad.
Sure.
I'm going, is it? Because we're having a pretty normal conversation right now. Oh, I can't hear anything out of this ear.
Got it.
And so once we get into the booth, I think the general perception is educating everyone on how to cheat a hearing test.
Okay. Yeah.
So don't.
So here's what we should do. We should just stop this episode, full stop.
Yeah,
but
exactly.
we have a duty to finish 5 more minutes.
And every attorney calling us.
And this is going to be the episode that goes viral for the very first time. And everyone's going to be like, you want free hearing aids? Listen to Ask an Audiologist.
Yeah, that's right. No, but so what ends up happening is I think that people think it's a lot easier to cheat and just say, like, I hear nothing out of this side.
Right.
But there's physiological responses that we can administer a portion of a test and have a very specific result that we're looking for.
Sure.
And somebody who's cheating is going to give us the exact opposite of that because that's what they think should happen.
Sure.
But they don't realize that.
It's not like they're well equipped to understand
trying
the
to tell you without telling you,
of an audiogram, right? They don't.
No,
they don't
it's
know
the auditory system.
Right. They don't know where it's being plotted. They can't. Assuming that they've even done an above average education on what a hearing exam does.
I'll give you one prime example.
Yeah.
The Stenger effect. So
Stenger?
Stenger. Stenger. Stenger.
Got it.
So
is that a last name?
It is.
Okay.
So if I play, let's say you have normal hearing. If I play the same sound in both ears at the same time, then you should hear it equally.
Right.
If you have a difference in hearing, right? Let's say I take that sound and I turn it up 5 decibels, 2 decibels. You should only hear it in the ear that's louder. That's the Stenger effect.
Got it.
You won't even perceive it on the other side.
Okay.
Right? And so for somebody who has an asymmetrical hearing loss, a true asymmetrical hearing loss, Stenger doesn't work. Right?
Okay.
Somebody who's faking it, you can do the Stenger and they're like, I don't hear it. I'm like, yes, you do.
Yeah.
Because we've made sure that you hear it, but you're telling us that you don't.
Got it. So
Gotcha.
Call the cops.
Call them now.
Call the cops.
Yep.
Right now.
I hit the button.
Hearing fraud.
I hit the button under my desk, under my audiometer. And the audiology police,
all the curtains are turned into metal, the windows are blocked, the doors sealed shut.
Yeah.
And then you call your wife in and she's the hard hitter.
I was just getting ready to say, we play good audiologist, bad audiologist.
Yeah.
And I'll let you guess who's who.
It's not Michael. He's not the mean one.
Her.
Yeah.
You know her.
She looked at me today and she said, you better do a good episode. And I said, whatever you say.
Yeah.
Whatever you say.
A foot shorter and 2 foot meaner.
It's
you know what I'm saying?
She's the loveliest human being in the entire world.
She's beautiful.
She's fantastic. We were scared of her, but we love her.
Yeah. Oh, I'm still scared of her.
So okay. So we've certainly talked about the people who have bad intentions.
Yep.
Is there like people who unintentionally do something that you're like, wait a minute, what was that about, and why did you think that needed to take place in this? Because now you've kind of screwed it up. You know what I'm saying?
Yeah, and that's pretty easy to catch early on. There's some of those patients that are just like high anxiety patients.
Got it.
And audiograms make people nervous. You're essentially shutting people into a soundproof or a sound treated room.
Yeah.
It gets incredibly quiet. If they have tinnitus, that's all they hear.
Yeah.
So like anxiety can kind of spike. So you get the serial button pushers. Click, 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 click. You know, you press a button when you hear a beep. Okay.
Sure. Got it.
And
it's like the most aggressive Jeopardy contestant ever.
Yeah, I mean, breaking the button type of thing.
Got it.
And this is across all ages. And then you get the kids that are like, yeah, I heard it. I'm like, well, no, I'm not playing anything.
Yeah, we haven't even started the exam
yet. So there's those sorts of things that we really have to pay attention to as audiologists.
Got
and
it.
We have to break our own rhythm.
Got it.
We don't want to be like beep, 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 beep.
Right.
You know, because that's too easy. It's too easy to fake. I'll give you an example. When I have a resident come in and we're kind of interviewing and things like that, I make them do a hearing test on me, and I will fake my way through the entire thing.
Okay.
And I can. It's a game. If I can beat them.
I feel like we just got Kaiser Soze. Here we are talking for about 9 minutes of how you should never do it, how we can figure it out, and then all of a sudden, Dr. Michael says, and I'm the biggest culprit of all.
Yeah.
It takes one to know one.
Exactly.
Right? Yeah.
That's fantastic.
But
and so that's
liar.
how you test them.
Yeah.
By openly faking it.
Well, they have to know. They
Sure.
have to be able to, as a resident coming into this field and soon to be doctor, they've got to be able to recognize those things. It'll make them a much better pediatric audiologist. It'll make them a much better advocate for attorneys, if or people who are in motor vehicle accidents or something like that. And also, if you are in a situation where you're going to be testing veterans, like that's something that the VA will want from you. They want to know that you're getting good, accurate results, and you're under contract, so you owe it to them to deliver those results.
Last question: how many people have come across your desk who have openly tried to fake a hearing exam?
Dozens.
Really?
Oh yeah.
Wow. I thought you were going to be like 5.
Oh no, like I can count on everybody's hands. How many? Like, but you come across that. I mean, that's part of it.
It's just common.
When you're doing something, when you are under contracts and things like that, where you're trying to, you know, where there's money involved.
Yeah.
There you go.
There you go.
You just have to be aware of it. It's going to happen.
And that's going to wrap up this episode of Ask an Audiologist. To learn more about this topic or any other sound-related queries, as in noise, sounds, not bodies of water, you can just Google that.
Fjords.
Yeah, fjords. Feel free to head on over to askanaudiologist.com. And if you have any more Game of Thrones questions, definitely don't come to either of us. I think we tapped all of our resources. Yeah, go to our producer, Daniel or David. I'm sure they know it far, far better than we do. Dr. Michael, sensational job.
Thank you.
We'll see you guys next week.
See ya.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
Do you, Dr. Jordan, I'm going to put you on the spot here, own some type of Bluetooth hearing protection device?
That's a good question. I don't.
Okay.
I don't. But
well, now we can't have Dr. Jordan on here anymore. She's no longer the authority. Yeah.